Our project is investment in grocery stores and transportation infrastructure to address food insecurity in Washington, D.C. wards 7 and 8.
Food insecurity is defined as having limited or uncertain capacity for acquiring sufficient, safe, and nutritious food at all times to meet one's dietary needs. Now, food insecurity is especially prevalent in Washington, D.C., where 10% of the total population faces food insecurity and is ranked at number 1 for the most food insecure children at 1 in 7. D.C. also ranks second for having the most food deserts in low-income areas. Food deserts refer to areas with limited access to affordable and nutritious food, particularly areas composed of predominantly lower-income neighborhoods and communities, and in which at least 33% of the population is greater than 1 mile from the nearest supermarket or full-service grocery store. DC is a very divided region in which there are striking disparities in wealth, income, health, and food access across different wards. Wards 7 and 8 of Washington, D.C. have the highest rates of poverty and the lowest income levels. 11.5% of D.C.'s total area are composed of food deserts, with Wards 7 and 8 making up 82% of D.C.'s total food deserts. Of 49 full-service grocery stores in D.C., only 3 are in Wards 7 and 8, serving a combined population of 161,000 people. Food insecurity in D.C. is an extremely complicated issue tied to a number of other factors, such as poverty, socioeconomic status, race, and thus related to other issues faced by low-income communities, such as poor medical care, higher rates of obesity, cholesterol, cardiovascular diseases, and more. This is particularly true in Ward 7 and 8 of D.C. Today, we'll be looking at food insecurity in Ward 7 and 8 of D.C. through the lens of access to food through grocery stores. The largest barriers to food security and access in Ward 7 and 8 are the scarcity of grocery stores, and inefficient and limited transportation options, and income level and poverty rates. The number of full-service grocery stores has decreased significantly in Ward 7 and 8 while increasing in other wards. This is due to a number of factors such as unjust zoning laws and regulations, site development issues, through permit problems, negative perceptions about the neighborhood retail markets, and difficulties connecting with target customers. Wards 7 and 8, however, have a surplus of corner stores and convenience stores, which sell mainly cheap, unhealthy foods that are processed and have longer shelf lives. Because many residents are so far from full-service grocery stores and so close to these corner stores, they often resort to consuming cheap, unhealthy food options. Transportation plays an important role in grocery store access. Along with the scarcity of full-service grocery stores, transportation is more difficult in lower-income wards, intensifying the issue of store proximity for residents. Affordable and consistent transportation is crucial because it allows for the mobility of a population, a way to access food resources. If residents cannot access the few grocery stores that are available, they are essentially left stranded from food access and turn towards cheaper and more unhealthy alternatives. Of 269 bus lines in DC, 0 serve Ward 8. In Ward 7, there are approximately 0.11 miles in between each bus stop, and there's extremely limited mobility due to overcrowding and limited bus lines. This is paired with a very unreliable public transportation scheduling system and metro lines that are not far-reaching and cannot serve the population effectively. Additionally, residents of Ward 7 and 8 have the highest proportion of carless households, making them a population heavily dependent on public transit. Wards 7 and 8 are also only somewhat walkable, meaning that only some errands can be accomplished on foot because amenities are too far for walking. This prevents residents from a free and very crucial mode of transportation. So here are two tables, the first showing the change in number of full-service grocery stores in DC by ward, alongside a number of other variables where we can see the trends of decreasing grocery stores and the percentage of individuals living below the poverty line in each ward, and then DC as a total. The second shows the number of full-service grocery stores in DC and transportation indicators for different modes of transport by ward.
This slide shows our issue from an economics perspective. As grocery store owners have negative perceptions of the market and consumers in Ward 7 and 8, the supply of grocery stores and thus healthy food options decreases. Because the demand for these goods stays the same, the new equilibrium quantity of healthy goods falls while prices are driven up. Therefore, there is a scarcity of both grocery stores and healthy food options in Ward 7 and 8. In a similar fashion, there is a limited supply of public transportation available to individuals in these wards, which limit individuals' ability to access these goods. current approaches to solve food insecurity in DC are inadequate. Charitable programs are unable to fully support those facing hunger. The combination of charity and government assistance programs are necessary to help bridge the meal gap. Programs such as SNAP provide temporary help for people going through hard times, providing supplemental money to buy food until they can get back on their feet. What we want to do is bridge this gap. Current policies provide temporary fixes for helping individuals who experience food insecurity. However, they fail to provide a long-run solution. Our proposal. In order to increase access to food in Ward 7 and 8, we propose a two-pronged approach. First, investment in transportation infrastructure so that residents have the mobility to access grocery stores and any other food resources available. Next, increasing the number of grocery stores and market and stores from which residents can purchase affordable and nutritious food. To increase investment in DC's transportation infrastructure, we focus on three aspects: the Metro bus system, safe transportation, and the Metro train system. In improving the Metro bus system, we first acknowledge the problems of the current system. Individuals in Ward 7 and 8 have limited access to bus routes with long walking distance to stops. They are subject to overcrowding and experience aggravations associated with faults of the current system. To fix this, we want to increase bus routes that serve Ward 7 and 8. Specifically, we want to create an additional 4 stops in Ward 7 and an additional 10 stops in Ward 8. Next, we aim to increase the number of buses that are en route. The purchase of 20 buses will increase the efficiency and the speed of the buses. We opted for a more expensive electric bus due to its environmental benefits as well as its lower operation cost. Lastly, we want to implement an educational initiative that helps individuals understand scheduling, location of routes, and purchasing of tickets, all designed to improve the efficiency of the current system. Our next aim in changing DC's transportation infrastructure is to increase the importance of safe transportation, including biking. Specifically, we want to create 7 miles of bike lanes in Ward 7 and 10 miles of bike lanes in Ward 8. By creating new bike lanes, individuals will be incentivized to bike. This will increase accessibility to grocery stores, employment opportunities, and education. Another benefit of increasing bike lanes is that creating a walkable community is attractive to movers. People moving into these communities can increase revenue, create jobs, and boost the local economy. While our main focus is on improving the bus system and safe transportation, we also want to fix flaws in the current train system. This includes an initiative to optimize train efficiency. It will form individuals on the train routes and schedules, increase off-board fare collection, and offer better communication to individuals on navigating the complexity of DC's train system.
Additionally, we'd like to increase access to nutritious food through grocery stores. So the first thing we would like to do are increase financing initiatives, loans and grants, tax incentives, and expedited permitting and zoning. We'd like to change these zoning regulations to lessen the obstacles for and attract new grocery retailers. Second, we initiate programs to foster the transition of existing corner stores to healthy corner stores that sell fresh food and healthy food options. And we're going to go a little bit more in depth on each of these parts in a little bit.
To offer an economics perspective of our financial incentive, to meet the demand for fresh goods, we must find a way to increase the supply. To do so, we will use funds to offer financial and tax incentives to private grocery store owners. With a strong monetary incentive to create grocery stores, the supply and thus access to healthy goods increases. As this supply increases, there is a greater equilibrium quantity and the price decreases.
Just touching on our solutions and our proposals again. First thing, investment in improvement of transportation infrastructure will reduce the distance between residents and grocery stores by saving them time, money, and energy. There's a direct link between poor transportation systems and lack of access to food, particularly in transit-dependent communities. Inadequate transportation options leads to higher total costs for residents through time and travel costs, which might disincentivize shopping at a grocery store or encourage the consumption of cheaper, more convenient, unhealthy foods. Further, it's imperative to attract and support new grocery retailers in these wards. Using financial initiatives, tax reductions, permit and zoning incentives have been proven to be effective in bringing more grocery stores to food deserts. New York City's food retail expansion to support health program, or FRESH, has seen success in these methods. Available for grocery store retailers, the Fresh program offers zoning and financial incentives like additional development rights, reduction in required parking, and tax deductions, as long as these stores are within the lines of an underserved community and meet the requirements for perishable items and produce. In Chicago, the Department of Buildings created a program that expedited the permit process for projects such as grocery stores, alongside incentivized fee schedules to foster development as long as said stores met their requirements for sustainability and health. And lastly, transforming corner and convenience stores into healthy corner stores will shorten the distance residents must travel to access food in a cost-effective manner while developing the local economy. This is cost-effective and can save money, as working with existing infrastructure saves the time and money of building a new store and also keeps the existing customer base. This transformation seeks to increase both food access and food education by providing healthy options to residents and replacing unhealthy ones through a multi-phase approach that broadly deals with inventory changes, marketing displays, business training, and equipment and technology changes. Some successful projects regarding corner store conversions include Philadelphia's Fresh Corner Store Conversion Program in 2013, which saw great results in increasing the access and availability of healthy foods in Philadelphia corner stores while spreading information and educating the population about healthy food choices. Additionally, we can see the Food Trust partnership with the Healthy Corner Store initiative had similar successes.
Effects on access and health disparities. Incentivizing the creation of new grocery stores to underserved communities will lead to an increase in access to healthy food consumption, neighborhood satisfaction, and mental health. Increased efficiency of existing programs such as SNAP, a reduction in diagnosis of high cholesterol and arthritis, and a lower prevalence of obesity. While increasing access and improving the public transportation system will lead to an increase in access to job opportunities, an increase in economic productivity by lowering the cost of moving individuals and goods, and improved access to better education. Our proposal as a whole will lead to a boost in the local economy through the creation of new local businesses, employment opportunities, and mobility. Calculating the direct and indirect costs of improving Washington, D.C.'s transportation infrastructure and increasing access to grocery stores, we would need to find funding of about $43,583,890. The funding for changes in DC's transportation infrastructure can come from federal government grants or local government agencies. As only about 2% of federal tax dollars are allocated for transportation and infrastructure projects, the following projects are designed to be both necessary and cost-effective. The funding for increasing access to nutritious food through grocery stores can come from public-private organizations and federal agencies. In creating relationships with public-private organizations, including America's Healthy Food Financing Initiative, we will be able to incentivize private owners to build grocery stores in low-income, underserved communities. After calculating the cost of building new bus stops, purchasing the electric buses, implementing an educational initiative, creating new bike lanes, and making improvements to the train system, I estimated that making the changes to the transportation infrastructure would take about $18,503,890. After calculating the costs of the financial incentives, tax incentives, expedited permitting and zoning, educational and marketing initiatives, and investing in equipment for these stores to help them store and sell fresh goods, I estimated that our proposed solution to increase access to nutritious foods through grocery stores will cost approximately $25,080,000.
Lastly, in terms of drawbacks and considerations, we do not foresee significant social and political aversion to our proposal. With that said, our proposal has 3 key limitations. The first is that, even if we improve transportation infrastructure and increase the supply of groceries and healthy corner stores, resident income levels are still low, and food price could remain an issue for some, even if they have access. However, the increased supply of grocery stores and healthy corner stores will reduce prices. Individuals will also save time and money in transportation costs, and our solution is a holistic one, which over time is likely to improve not only access to food, but health outcomes, education, economic development, and more. Secondly, as our solutions require a significant amount of funding, we see this as a potential obstacle. Still, in regards to the funding required to support and attract grocery retailers, we recommend increased partnerships from the federal government and public organizations with private funding organizations to provide grants, loans, and other financial incentives. An example of the result of the public-private partnership is America's Healthy Food Financing Initiative, from the partnership of the Reinvestment Fund and the U.S. Department of Agriculture. Other potential funding sources include the Food Access Fund, the Good Food Fund, and the Food Trust. To fund the improvement of transportation infrastructure, working with the Department of Transportation's infrastructure grant program, such as the INFRA grant program or the raised discretionary grants, can be very helpful. Additionally, working with the Build America Bureau and a relationship with the Infrastructure Permitting Improvement Center can help with alleviating the financial and logistical burdens. Thank you.